Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for tuning in on this beautiful summer day, although definitely hot. We'll keep it short and sweet. We're going to talk about the COVID situation and also put out a call for you all to hopefully get involved in a few different ways in some of the things we have going on, really in response to COVID, but just also more broadly, all the things we're working on as a team. So excited to share that with you and hopefully get you involved too. In terms of the COVID situation, I'm very pleased to report things still look good. All the numbers and data look good and encouraging and positive. Since the beginning of the pandemic, we have now had 2,081 total cases. That's out of 61,200 tested. So that total number of positives since the beginning of the pandemic keeps ticking down, which is good, and we're getting close to 3% for the whole time period. And again, if you remember, we were well into the 20s and 30s at the peak of this, so I'm pleased to see that progress. We are continuing to hold at 91 fatalities, thankfully, now for quite some time. And we see the number of recovered continuing to go up, which is great, 1,827, including one person in the last few days who recovered and came out of the hospital. So that is good news. Our 10-day out projections continue to look optimistic and pretty close to flat, which has become the norm in a good way. In terms of hospital capacity, we are still hovering around that same number that we have been around. We now have one individual in Ulster County hospital beds right now. As I said, we had two last update, so that's positive development in that regard. And you can see really the trend line. At this point, we're basically have been at almost no hospitalizations for several months, which is exactly where we want to be, of course, and hope to keep things that way. In terms of active cases, you can see on our graph of active cases, we're still hovering right around that 150 to 200 range. Right now, we're at 165. And that really also has clearly, you can see the trend there starting in end of June, early July, where we've held right around that level now solidly and stably as we've had the economy open largely. I mean, obviously not 100%, but it is very encouraging to just take a step back, and we think it feels a long time ago, but it wasn't that long ago that we were going through these 4 phases and slowly, deliberately reopening things, and to see those numbers hold where they are of active cases and new infections, that is definitely validation that we are able to do this, that if we follow all the different protocols, we can keep this thing in check. And that's in the face of lots of evidence in other parts of the country, as we know, where that is not the case. Most important metric, as I always say, is the number of new positive cases each day. And you can see that on the graph. The orange line represents technically a moving average of those new positives, and the blue bars represent the total tests given in that day. So in the last 48 hours, we've tested 1,227, and had 15 new positives among those tested. So that puts us just over 1% new infection rate, 1.22% to be exact. We do want to see that number stay right around or ideally below 1%, but we're pretty comfortable with the fact that it does ebb and flow a little bit, and that we have pretty consistently been around that or below that 1%, with a few exceptions largely tied to proactive testing in our state prisons in the county. So again, top line, feel very good with where we're at with infections of COVID and new infections in the county, and that is positive news. And hospital capacity, as has been for now months, we have very robust hospital and treatment capacity. I do again remind myself of the situation we were in only in April, where we were down to very few beds. We were down to one ventilator for the entire county for 180,000 plus people, and we were very concerned and even prepped additional surge facilities. So I don't want to lose sight of the fact of how much progress we've made, and I do think that that is important, that until we keep that in mind, that until we have a vaccine, which will hopefully be soon, that is a very real thing that we have to continue to put in the work to make sure we don't go back to anywhere near that place, please. So how do we do that? It's the same reminders that I remind and ask you to do every time, but we'll continue to do so until we are through this thing, which is please wear a mask, please maintain that social distance, please wash hands. I know I can say for me, candidly, like, it's getting old. I get it. The masks, when it's 90 plus degrees out, are getting old. It is easy to say, well, you know, the numbers look good, and why do I need to keep doing this? But again, please remember that that is not an automatic thing, that we are not on autopilot at this point. We have to keep, you know, to use my bad metaphor here, keep steering manually and making sure we're doing all the right things to keep us in that good place. So please keep it up. I'm proud of what we've done, and we should all be proud of that because it's been really tough. But let's not erase that good work. Switching gears a little bit as we talk about other things going on. I think to sort of frame what's going on and where we're going forward, we should keep in mind, as I said, what we've done to get here, what we've done as a county and as a community. And in particular, I do think back to what we did with our food program and are still doing with Project Resilience in terms of feeding people in this critical time of need. How did that all work? We came together and we had individual volunteers and restaurant owners and donors and many others all step up and say, even in this time where I feel afraid and concerned and at risk, I'm going to think about and take care of others in the community. So that spirit of community and service in service to the greater good is what has gotten us to this point. And as we go forward and dig out of this hole that we're in, that is the same. We really have to double down on that spirit and that sense as we work through the recovery efforts. So I wanted to, beyond specific, broadly saying that, offer a few concrete opportunities for folks in the community to get engaged and get involved on those issues. The first is, you may not know this, but Ulster County has a series of different boards and committees that provide community input and oversight to me, to all of our departments, and even to our legislature in some cases, to actually have the voice of the community guiding what we need to be doing. And we have several vacancies open on many of those committees and boards, several of which have immediate direct application to the recovery efforts that we're undertaking now. So anybody out there that is willing to serve in this capacity would be greatly appreciated. And this is really an opportunity to help be a part of setting the direction for where we're going. So I'll put up some of what these vacancies are just to give you a sense. The Community Services Board really oversees our health and mental health services. There's a subcommittee under there specifically focused on mental health. We know and have talked about the fact that we are experiencing huge challenges and growing need in terms of mental health, at the same time that we've actually seen our largest hospital system pull many of those services out of our county, much to my and our frustration. So these committees and these groups specifically, Community Services Board, and our mental health subcommittee of that board, are going to be really focused on immediate solutions, yes, but more so the long term and the medium term. How do we address these challenges? Additionally, the substance abuse community, as you could imagine from the name, is also focused on, in the midst of a resurgence, tragically, of particularly opioid overdoses and fatal overdoses. This group and committee will be focused on addressing those challenges. And finally, we have a committee for people with developmental disabilities, who we know have been extremely impacted mostly in a detrimental way by COVID and the challenges that have come with that, between isolation, often not being able to see family members, and often lack of access to many of the services and resources that they need, even in the best of times. So all of these vacancies for positions, I would love to be filled by members of our community who care and who want to get involved and have ideas. You don't need to be an expert in these. You just need to be passionate about our community and be willing to put in a little bit of work to get smart on the issues and to figure out how to bring your voice to bear on the issues. So if you're interested in applying, the details were on the screen. We'll put them up again. It's on our website. You can reach out on social media, but preferably if you send an email to me, actually, at exec@co.ulster.ny.us. Sorry to make you spell that out. If you send an email to that email on the screen, and put in which committee or committees you're interested for, we'll make sure to flag that and get that and take a look at that. And again, we'll put this info up on the website as well. And really, please spread the word and encourage folks to serve, especially in this critical moment. We need really all hands on deck to get through the challenges we're facing. A few other similar opportunities and one ask as well. I've talked about this before, but I'm going to keep hammering away on our census, because this is just absolutely vital that we have a complete and accurate and full count of how many people are here, so that we can get all the funding and resources we need for education and health and infrastructure and a whole other set of critical public services at this important time. We are still well below 2/3 response rate as a county on the census. And so I want to ask you again, and I made a joke last time and I'll say it again, please spread the word, and even if that's to random strangers on the street, as you pass them by, prompt them and encourage them to take takes about 1 to 2 minutes, I'd say, to do the census. You can do it online now as well if you prefer. And the easiest way to do it is I think online, my2020census.gov. And we also have information on our Ulster County website that can get you directed there if that's your preferred way. But please do it yourself, and then encourage 4 or 5 others that you know who haven't done it or might not have done it to do that. The final opportunity to get involved and to make your voice heard is actually kind of related to the census. Another inside baseball kind of wonky thing we do is every 10 years after we do the census, we decide, we really set the districts for all of our elected representatives, from the county level to the state level to the federal level. All of those districts ultimately are informed by the census numbers. So if we don't have a full census count, we actually are at risk of losing members of Congress, maybe losing representation at the state level, and your area could get underrepresented when it comes to county government or local government. So that's another reason to complete the census. Once the census is complete, and once we have great numbers, which I know we will, we'll pull it in strong as we get to the finish, then we actually set up what's called a commission on reapportionment. And this only happens every 10 years. And this is actually the work of sitting down as a group, in this case, a 7-member group, and drawing the boundaries that we all sometimes complain about of how our different districts are set up. So in our Ulster County legislature, we have 23 legislators who each represent 1 district. Each district right now has about 5,000 residents in it. Where those lines are drawn obviously has a big impact on who those representatives are and who those legislators are. So the commission on reapportionment will actually get together and, using the census data, establish these boundaries. And so this is another opportunity for folks to serve and get involved. This one involves a decent amount of time to make sure that this is done right. And one of actually my favorite things about this commission is that it explicitly can't have any elected officials on it. So I think that's a great thing. And all the prerequisites are on our website as well. And we can put them up. I think it's on the next slide, I believe. I can't remember if that, oh no, that one's not on there. We will get those details out as well in terms of what the requirements are. But essentially, we want residents of this county who are invested in it, who work here, who have families here, who care about getting these critical services to be a part of this discussion. And so I will be selecting a pool of folks from those who apply, and then the legislature, those 23 legislators, will pick from that pool. That's how that process will work. But the first step is for you to decide, I want to be a part of this, and to do the similar process as I mentioned before, which is just shoot us a note at that same email and let us know you're interested in the 2020 reapportionment committee. If you want to send us an actual letter as well, we always appreciate getting letters in the mail like we all do. So there's our mail address. Both of these have pretty tight timelines, but the reapportionment one, we really need folks to get signed up and make their interest known really in the next few weeks, because this will have to happen quite rapidly on a timeline set by the state constitution coming out of once the census is complete. So we want to get this stood up, and we want you involved. So those are a few different calls to action and ways to get involved. And again, if you have that spare time, or even if you don't, but you're willing to make some, we would love to have you get engaged. And if you have questions, you can reach out with those as well. If you want more information about the time commitments and so on, we can talk you through that too. So those are my requests and ways to get involved. As we close out for this briefing, I hope we continue to stay in a good place. So much of the reason why we are in such a good place is because of so many that have been working on the front lines to keep us healthy and safe and educated and fed and getting deliveries and all the other things that we used to take for granted oftentimes, that have now meant putting yourself at great risk. So continue to thank all of our frontline workers who are making that happen, and each of you for the part that you've played, whether as a parent, a spouse, a friend, or someone running a business or working at a business. Everything you've done to get us to this point, we appreciate and ask that we keep going. So that is it for today. It's a relatively quick update. And it's pretty good news. So we'll take it, and we'll carry that forward into the rest of the week. Our next update will be Thursday at 2 p.m. And if anything critical happens in between, we'll definitely let you know. But thank you for tuning in. Please continue to be safe and healthy and take care of each other and be resilient. And we will talk to you Thursday.